You're listening to Radio Cosmos.
All night long.
Bravo! My compliments, little lady.
Commercial!
Break for 30 seconds.
You are now listening to BaaD Radio.
Hello and welcome to BaaD Radio. If you are tuning in for the very first time, BaaD stands for Business at a Distance. This is a show about local businesses and the positive impact of business networking. Personally, I love to talk to our local businesses. We are here in the News Radio WFLA Orlando studio from 11 a.m. to noon every Sunday. I'm Chelsea Zerpola, Chief Marketing Officer for Florida Energy, Water, and Air. I'll be hosting today. Help me welcome Dr. Stephanie Kern from New Age Wellness in Castleberry. Welcome, Stephanie. How's things?
Good. Really good. A little gloomy outside today, but otherwise really good.
It is. I think we're all hoping for the sunshine and hoping that we'd have a little bit of a different weather pattern. Mm-hmm. Us Floridians don't like this cold weather at all.
Not at all. Yeah, I'm a natural-born Floridian, born in Daytona Beach. So
no, you don't like this weather at all. The little bit of snow and stuff, I think everybody's a little bit sore or at least feeling it. I know I am personally.
Oh, yeah, for sure. We have patients that have joint replacement surgery sometimes with that metal, and it just makes them really super achy when the cold snaps. So they definitely are in and out of the office more.
I bet.
Yeah.
I bet. So let's get into your business and kind of tell us a little bit about you. Since I'm new to you, it'll be fun to kind of unpack and understand a little bit about what you do. Mm-hmm. So what moment or kind of story inspired you to launch your practice?
Well, I always wanted to be a practice owner when I graduated all those years ago in 2013. Yeah. So I've been out in practice for quite some time. So I, been out in practice working here and there in different practices. Sure. And, my uncle's a chiropractor as well. So I'm a second generation chiropractor, and he taught me a lot that I know and got my interest into helping people naturally with just my hands and helping them avoid surgery and get a good quality of life through natural holistic practices. And he's up in North Carolina, but that kind of, inspired me to do what I do.
That's amazing. I think anytime that you can take something that you're passionate about, especially when it's family and saying second generation, that tells a lot of the story of that passion and the ability for an individual to have a better type of life. I know, like you mentioned, when someone has those achy bones or they just don't want to get out of bed that day because they're going through just such a physical ailment, you must have such joy in what you get to do every day.
Well, yeah, just kind of sharing a little bit about, my uncle's story. He unfortunately was injured in an attack. Somebody had attacked him, and he had emergency, open heart surgery, and which saved his life. So medicine definitely has a place in life-saving, measurements. But and through that surgery, he was having complications with his arm. And so he visited a friend of his, a chiropractor. He was having some nerve pain in his arm, and he was able to recover quicker and get fully, recovered with chiropractic care. So that's when he changed his major from pre-med to pre-chiropractic because, as much as medicine helps with, saving lives, when you're talking about quality of life and how you live your life, that's where holistic measures and what we do at New Age Wellness really steps in and gives you that.
Sure. So walk us through, for those of us that maybe are just understanding or hearing holistic care for the first time. I know there's a lot of new listeners or maybe listeners that just don't understand the difference. Mm-hmm. Kind of unpack that for us and walk us through that. I think there's a lot of people that are looking for alternatives every day.
Yeah, of course. So you think of the allopathic model that is there, and let's say you have knee pain, for instance, and you go to your primary care. And so they're going to first prescribe you an opioid or a medication because they're trained more in toxicology and pharmacology. Okay. And so they're going to give you the cortisone injections, go through the anti-inflammatories, and really kind of just go through that measurement, and maybe even maybe in physical therapy or a specialist consultation where you'll see a surgeon. And so, that kind of medical model we see doesn't work for a lot of people, so, and once you go through a surgery, it's very permanent and has very high risks. involved with that. So that's where we step in, where we give you all the options under one roof to avoid medication and surgery for whatever is paining you. So we have, chiropractic, we have massage, we have, physiotherapies, and also we have a great nurse practitioner that helps with regenerative medicine, meaning things like stem cell injections or PRP injections, which are more natural and safer than some of the medical options.
I think there's so many different options out there. Just having the conversation and listening to you talk about it, I'm like, so many of these are foreign to me, right?
Okay.
But how can, someone like me listening learn? And I think half the battle is education. And I love the way that you are kind of explaining it, because not everybody knows. And I think it's so important for us to understand there are alternatives, and making sure that we're having, that better life and the better route to life for many of those individuals that either had a surgery. I mean, there's lasting, detrimental things that they're going through. That's interesting that the knowledge, because I think forever we're taught, just go to your primary. This is what they're going to do for you. And then you accept it, Kind of walk us through some of those success stories that you've seen, maybe in those unique cases that maybe that person didn't have any other alternatives, and you just really were able to make a difference in their life.
Yeah, so many come to mind even just this past month. And you can look on our Google page, our website. Yeah. We have a lot of information on there, and testimonials and Google reviews and things like that. But, one example is we had a guy that was a driver for the Department of Transportation. His livelihood, relied on his ability to function properly. So he had some knee pain that he had from a light lifting injury, work related, and he'd gone to an orthopedic. He'd gone to a couple different doctors, and still, was prescribed medication, and it was just masking his symptoms, and it wasn't really curing or healing anything. So that's when he sought us out for like a shockwave therapy, and which is something we do here in the office too. So, and within, I would say, 4 to 5 visits, his knee pain was completely gone. He was back to driving full time and still stable to this day. And he was, definitely mentioned us on Google and stuff like that. So that's just one example.
Yeah, I know you had mentioned when we were talking earlier that you have some new things that you're doing in your practice, and Shockwave was one of those. Yeah.
So Shockwave is an acoustic wave therapy. So what that means is that, it provides a sound wave that goes deep into a joint and does several wonderful things. So one of the things it does is it speeds up healing of a chronic or new injury. Okay. It actually activates your own body's what's a fancy term is angiogenesis, which is new blood vessels, new blood flow, which also helps with healing.
Sure.
And then it activates your own body stem cells to repair any kind of damage that's going on. And so it's really effective for any joint in the body that's giving you issues, whether it's a shoulder, plantar fasciitis in your feet, neuropathy, neck pain, back pain, things like that.
Wow. It's, again, so many new terms, but I think so many individuals need to hear that there are alternatives, which makes it exciting. Tell us where you're located in Castleberry, and, if an individual is really interested, what's the best way for them to go about getting an appointment or setting up a consultation?
Yeah, so we're in Castleberry. We're right off of State Road 436 near Redbug Lake Road and Wilshire. So we're in a very busy area, very convenient for folks. We're open Monday through Saturday, so you can call the office. A lot of patients decide for convenience at like 10 o'clock at night when they're relaxing in bed. It's easier to schedule at that time. Sure. So if they're scrolling, they can go on our website, they can go through our portal, and they can put all their information in and get on our calendar that way as well.
That's awesome. Do you have a super long wait time, or do you have some slots open for those that maybe need to get in right away?
Yeah, so we're pretty flexible, and we have a lot of slots that are usually available because our office hours are very lengthy. Like I said, we're there 6 days a week, so
Sure.
Makes it a lot more convenient, flexible for moms or folks that work during the week to get in on like a Saturday morning appointment or Friday afternoon, what have you.
Awesome. So we are going to go to break. When we come back, we're going to talk a little bit more about all of these new amazing therapies that, again, I haven't heard of, but I think are so important for the community and for individuals to learn about. So thank you so much, Dr. Stephanie.
Sure. Yeah.
Welcome back to BaaD Radio. This portion of BaaD Radio is brought to you by Body Street of Winter Park. Experience the future of fitness at Body Street of Winter Park. Lose weight, build muscle, and tone your body in only 20 minutes a week. Visit bodystreet.us to sign up for your free trial today.
We want to pump you up.
Steph and I will be there on Saturday. I'm super excited to see you. So we are back in studio with Dr. Stephanie from New Age Wellness, and we were talking a little bit about different ailments, different things that individuals might go through. And they definitely sometimes think that the only path is to go to their regular primary. But it's been a great conversation with Dr. Stephanie about the alternatives and how you can really take this in a whole different way. So walk us a little bit through your typical first visit. If I were to come to your office, kind of walk me through that.
Okay. Yeah. So, I mean, the first step is always to we need to get to know each other, right? We need to know, of course, your body better than anyone. So, but we need to get a kind of an introduction into that. So first we consult with you to see if it's something that we could even help you with, and if not, we can refer you to somebody that is best for that. But if it is, then we'll move forward with an exam. Of course, take your medical history, your vitals, all the things that make you you, and then dive into what brings you in there, like what pain, what condition, and what kind of things you've already done to treat it. So if you've already, and those are the kind of cases we see a lot, where patients have tried, other chiropractors even, physical therapists, they've seen their primary, they've seen a specialist, and they're still dealing with pain, they're still dealing with an ailment that's maybe new or old. And so, and then we move forward with, treating it maybe a little bit, maybe gathering some more information like medical records and things like that. And then go over like a treatment plan for you and say, hey, we can take your case. This is what's going on and this is what we need to do and to treat it and get it resolved for you once and for all.
Usually is it a couple of visits, or I guess it probably depends on whatever that particular ailment might be. Mm-hmm. And I love that you said there's a plan, right? Yeah. Putting that comprehensive plan probably makes consumers like myself extremely comfortable knowing that these are the next steps. Because oftentimes you'll see your primary and then you kind of, for a couple weeks, are in limbo because you don't know where they're going to refer you to. And then maybe your ailment gets a little bit worse, right? I love that you have a plan. You know exactly the time frames that you're going to see those individuals. When you're talking through and I'm super curious about holistic care and the importance of that, let's dive a little deeper because I want to understand, and I'm sure a lot of people hear that and they're like, what does that really mean? Sure. I think all of that is so important to individuals that are, again, looking for alternative care, but not quite understanding what does that, yes, it's an alternative, but what are the details of it? Like, what are some of those treatment plans look like, and how can they help?
So we always believe in your body is the best medicine of all. It's designed to heal. Sometimes it needs a little bit of encouragement, it needs a little bit of help. So of course we're dealing with things that are more natural approach, that are non-invasive, non-surgical, or non-pharmaceutical based. So these therapies are meant to speed up the healing process. So for shockwave, for instance, let's say somebody comes in with really bad golfer's elbow. They've been golfing a lot and their elbow's really inflamed. And so we go over like a shockwave protocol. Now, of course, if you bring in something and it's been going on for over a decade, it's probably not going to be fixed in one treatment.
Sure.
So we're going to design maybe 1 or 2 or 3 different options for you that will break down the percentage of success, how many visits it'll take, and what different procedures we would, incorporate with that to get this, to your goal of pain-free. And so it gives people a lot of resolve, and it gives them kind of like an exhale of relief, like, oh, great, I can finally maybe get back to golfing. I can maybe get back to, work and some other things that they need to do without having to rely on these medications that they've been taking all the time that aren't working, or eyeballing down a procedure, a surgery that they desperately want to avoid. And so that's what we go over.
I think having that insight is so huge. Just that you have all of these different opportunities or treatment plans that can help an individual. I know for me, I have huge problems with my sciatic. I mean, that is like, and it only is certain times at certain parts of the month, and don't know why. It'll just pop up. You know, for someone like me, is that something common that you see?
Oh, sciatica for sure. And so sciatica, there's probably like 2 or 3 different options that we encourage and promote in our office to treat it successfully without drugs or surgery. And one of them is spinal decompression therapy, which helps gently stretch the spine and take that pressure off the sciatic nerve if the root cause is a nerve issue. Sometimes it can be from overly tight muscles, or it can be from dysfunctional joints that just need a chiropractic adjustment. So we see the patient, see how long they've been dealing with the issue, what is the root cause of it, and then go forward with, maybe some spinal decompression sessions and chiropractic manipulations and things like that. And, from our treatment plans and our research, it can give you up to 4 years of pain-free relief, and keep you away from surgery and pain.
I think surgery too, there's that fear, the fear of the what if. Right. As the older you get, the more fearful you become. Right. I remember when I was a kid, I'd dive into a lake and, with alligators. I didn't care. It's different when you're younger. You'll do all kinds of things. As you get older, that little bit of fear or apprehension, right? You're not as brave as you used to be.
Right.
And I think, just having that ability to say, okay, there are alternatives. I don't have to worry about maybe going through a surgery and then having to be on medication that I really don't want to be on. Because I think those are the things that also keep you from moving and going. And oftentimes those are the things that, I know for watching my grandparents, is they were always super active. Even my mom, she's 73 years old and she's extremely active. Like, she's in her garden. She's doing all kinds of stuff in there. Like, she runs circles around me, but she was always active.
And that's what the kind of lifestyle we want for our patients. We want them to be able to age and be able to play with their grandkids and be able to travel a lot and be able to do the things that they want to do in retirement. And so the last thing that people want is to have to recover from a joint replacement surgery in their retirement years and have to be laid up in bed and not enjoying their life. So that's what we help with.
I think that's amazing, and I would imagine that you have a lot of joy in that.
Oh,
because
absolutely.
you get to see the patients that maybe would be stuck and be more sedentary and not being able to move, being able to enjoy going and traveling and doing all the things. Like, we all work so hard during our prime years, and then it's sad to see the older generation just stuck at home because they have ailments or things that keep them from enjoying all of those things that they work so hard to get to, and they're not able to do it.
And even if patients aren't experiencing any pain when they're younger, in their early 30s and their late 20s or whatever stage of life that you're in, the average person doesn't see and seek out chiropractic until their 40s.
Wow.
And that's usually because at that point, some degeneration and wear and tear has set in, and that's when things get painful, achy, and stiff. And so then they present because they're finally exhibiting symptoms for an underlying issue that's been developing for years.
Wow.
And so, I encourage patients to seek out regular maintenance chiropractic, even if they're not in pain, because just like you see your dentist for routine cleanings and you prevent things like cavities and terrible tooth ailments to set in, we can do the same thing for your spine and your joints to keep things from developing.
At what age can, that's interesting that you mentioned that. At what age is it appropriate? Is it from a level of a child all the way up? Walk us through that, and then we'll kind of finish this segment with that. But I'm super curious.
Yeah. So I just saw an 8-month-old this week from a patient of mine, and they just had a baby. And, the mom had started noticing that there was a little head tilt to their child that they just were concerned about.
Sure.
So, you take your kid to your pediatrician sometimes, and they just say, oh, well, they'll grow out of it, or, last thing you want to see is your child go through specialists and things like that for a simple dysfunction. So brought the kid in and did an exam, saw that there was some dysfunction in the neck. And we very lightly did a light manipulation, got them moving better. And, I had found out through the exam that while the child was going through the birthing process, they weren't able to detect it early, but the cord was actually wrapped 3 times around the child's neck.
Wow.
And was causing some neck joint dysfunction from that.
Wow. Well, thank you for sharing that. We'll be right back. After this quick break, you're listening to BaaD Radio on News Radio WFLA Orlando. Welcome back. This portion of BaaD Radio is brought to you by Ground Up Property Services. Do you know what your sprinkler system did last night? Probably not. So now is a great time to get your irrigation system serviced by Ground Up Property Services. Be sure to ask for Rick Hall with Ground Up about a water sensor too, so your lawn doesn't get too much water. Call 407-468-4295 or visit groundupinc.net. All right, we are back with Dr. Stephanie, and we were talking about at the break, at what age is it kind of appropriate? And she was sharing an amazing story about an 8-month-old. But kind of share a little bit more of those stories. I think oftentimes we don't think of preventative. We think of that ailment's happening and I need emergency help, right? Mm-hmm. So walk more through the aspect of having the ability to be preventative versus a crisis.
Right. Yeah. So of course, like our main patients come in to treat because they're in pain, whether it's from something they've been dealing with a long time or something immediate, like a car accident, they were in and they need care. So we're the best people for that. But of course, like we also talk about our maintenance population, our wellness population. So we do see, children, we check children and screen them as they're developing and hitting those milestones when they start crawling, developing their spinal curves. They start walking, and then also when they're going through, young adult years, and they start playing sports, and they we start screening them for things like scoliosis, and obviously helping them avoid those braces and those developmental issues.
Sure.
So definitely have a large pediatric population with families and people that just want their families well. They want them performing and feeling 100%, because it's really easy to grow a healthy adult than it is to fix an injured, sick one.
Sure.
So prevention is always better than cure, in my opinion.
It makes a lot of sense. And I think as we're looking at, I know my kids were athletes. They were always with one or another injury.
That's awesome.
I mean, they were all, my oldest son, that was his passion, right?
Oh,
everything
nice.
he wanted was football. I wanted to be a football fan and a football mom. And I was, that mom that would get out there. But these kids were tough. Mm-hmm. I mean, you'd see they clash. They would, they're football players, right? Mm-hmm. And you don't realize the impact that has on a young person's body that's just developing. Mm-hmm. He played since he was probably in the 5th grade. Well, they're still developing. Mm-hmm. How much of what you do is kind of around maybe athletes or those that, have those rough and tough, maybe they're a wrestler or whatever, but they have those rough and tough moments, and they're every single weekend, right?
Oh yeah. And the competition is not getting less when
they
it comes
tough
to
kids.
So.
They are so tough, right?
Yeah. And the regimen and the training regimens they put these kids through are just getting more and more, competitive and more rigorous, and a lot on the body. I mean, we treated a baseball player that was in his teen years, and he's wanting to think about college and his later goals and career choices, and so he was dealing with a labral tear in his pitching arm, and so we were able to go through some options for him. Because, these kids do not want surgery. They do not want to have to go through that with also downtime, because things like surgery in a shoulder can take even 2, 3, 4 months to recover with post-operation rehab. So they're not playing for the next season, so they consult with us for things like stem cell therapy and PRP injections to help regenerate any kind of condition naturally without surgery.
Wow.
And we of course encourage like physical therapy and those types of things as well.
That's amazing. And I think that becomes such a critical option, right? For those that don't want to have those downtimes. I know when my son had his first injury, we were, what do you do? He had, he dislocated his shoulder, and what do you do? Like back then there wasn't not a lot of options, he's an adult now. So oftentimes you look back, but there wasn't a lot of those options. No one talked about alternative care in any way. And I think if those were more options that were presented, of course, that's what I would want for him. I'm sure that it's, not only a long healing process, but it's also so scary for a young adult that just wants to go to the next level. It's their passion.
Absolutely. And, these kids, they should be under regular chiropractic regimen while they're in season, whether they're playing soccer, baseball, football. These teams like you see professionally in the NFL, and baseball and hockey, they have all team chiropractors and orthopedics on staff because it prevents injuries by 30%, which if you could prevent an injury, great. Yeah. So, these kids while they're in season should be getting regular chiropractic care to keep their body at 100% while they're playing and to reduce injuries. We treat plenty of kids that play these sports, even, football players in their adult years we've treated in the NFL, and, we've able to help them, have the best seasons and pre-tryout seasons because of it.
That's amazing. Have you had any professional sports individuals come through and you work them through that process?
Yeah. I mean, of course, I can't tell you their names,
no,
but
of course not. No.
Yes. We've had some come through, and of course, like I said, like the everyday teenager too, and playing in baseball and wrestling and those kind of sports as well, and javelin and all kinds of things.
I did a ton of sports stuff when in my last role, and so being around the athletes, they're so inspiring. They are so tough, and they're just. This is a whole different world for them with the NIL and everything that they're doing.
They beat their bodies up.
Whew, it's like they'll do anything. And so I got the honor to be with some of the offensive linemen from a really big school. I won't say, but these amazing young men, I mean, they're gentle giants. They make me look like I'm like a mini.
Oh, wow.
Because they are so huge, but they are so kind and so wonderful. And so you always think about, what if they were to go through an injury, or what if they needed, alternative care, and, how many of them know that's even an option. It's crazy that it's, we're this far in life and there's so much technology, but there's not a lot of people talking about it.
Yeah. So our message is to get out and educate, and doctor means educator at the end of the day, and teacher in Latin. So that's something that we always try to, at the worst, just book a call with us, consult. I mean, a conversation. What's the worst that's going to happen from that? I mean, at everything, you'll have everything to gain in your health, and you lose nothing. So just having a consultation to see if what we do is something that would work for you is something that at the end of the day it's not going to hurt anything.
And I think it's time well spent, right? We all say we're so busy, we can't make that happen. And oftentimes those are those very things that maybe, we had an injury and we just thought we were going to get better on our own. And oftentimes it ends up getting worse instead of us just being proactive and making sure that we're taking care of us and stop with the, I'm too busy, I can't do that, I'll have the time. I think we're all that way. We all don't have time, but if they can have that time well spent and be educated and allow them to come and really understand what makes you so different, right? And so great within that realm, I think there's a lot of things that would be better for many people. So that's exciting. So what are some things that you would like to tell the audience or someone that's a first-time listener about you?
Well, I love what I do.
I can tell.
I treat patients like my family, and I care for them like my family, and I'm going to tell you, the best decision that I think would help you. I'm very clear with patients. If it's not something we can help you with, hey, we know a plenty of doctors that can help you. So, that's one thing that sets us apart, makes us a little different. So, and I would say that if you are experiencing pain, don't ignore it. If you see something on the dashboard come on your dashboard in your car, last thing you want to do is ignore that, take it into a mechanic. Same thing with your body. Don't ignore it. It just gets worse.
And I think those are the critical signs, right? Our body's trying to tell us something. And sometimes we ignore it, or we say, I can put that on the shelf until next week. And then next week becomes next year. And then before you know it, you're dealing with a lot more of a situation. So thank you so much for sharing that. We're going to go to break. You are listening to BaaD Radio on News Radio WFLA Orlando. Welcome back, and this portion of BaaD Radio is brought to you by Frogger's Grill and Bar. Looking for a place to go with friends or meet new ones? Then you're looking for Frogger's Grill and Bar with 4 great locations: Oviedo, Mount Dora, Apopka, and Altamont Springs. Be sure to check out Frogger's amazing menu where everything is fresh and never frozen. Frogger's Grill and Bar. Hop in with food and fun.
Yeah, boy.
All right. Well, I wanted to talk a little bit when we're coming back from studio, and we've been talking to Dr. Stephanie, and I think, you know, what I get to do every day kind of is a little bit related to what you do. So at Florida Energy Water and Air, we really educate individuals on the power or the importance of clean water. And so we do full home water treatment program that allows you to be able to make sure that all of those PFAS and, you know, microplastics and all of those things are removed from your water so that you can make sure that not only is your body healthy, and we're talking a little bit about, you know, preventative, but this is a great kind of tie-in. And I'm excited because oftentimes when we have a guest in, sometimes it's relative and sometimes it's not. But in this, health and wellness, and it's the health and wellness of your home, right? Because again, appliance longevity, but it's also the health and wellness for you as an individual or your family. Because again, it allows for all of those things that everyone's talking about. I mean, there's a ton of news right now about microplastics and all the things that it's causing detrimentally to your body. So I wanted to talk a little bit about that, but we are excited to have Dr. Stephanie here with New Age Wellness. Thank you so much for spending a little time with us today. So again, as we unpack this a little bit more and understand what are some unique things that we haven't talked about that I think that maybe our listeners would like to learn about when it comes to your practice.
Yeah, I mean, just to touch on what you just said, like with your field and how it connects to what we do in our field, like with holistic wellness, chiropractic at the basis of what we do is part of a philosophy of the 3 ailments that make somebody or affect our health. And so that can be thoughts, toxins, or traumas. So things that hurt our body physically would be considered a trauma, car accident, things like that. And thoughts, of course, emotional stress, and always helping with those like stressors. And women carry a lot of pain in their necks and upper backs because of it. And so we help with like Swedish massage and things like that. But of course, the things that we put in our body, like the microplastics and, toxins that, with what we're eating, what we're drinking, that plays into it, of course, as well. And we talk about nutrition. We talk about, proper vitamins that we do recommend. We do IV vitamin and treatments for patients that really need a high dose of vitamin C and magnesium chloride and a lot of things that they're just not getting in their diet, or maybe they have a stomach issue like celiac or IBS or Crohn's or something like that, where they can't absorb what they're taking as a capsule, and so they need it right into their bloodstream as an IV infusion that helps them feel energized, helps them detox better, just helps them focus better and all those kind of things. So that's probably one thing that also we promote in our office. So
that's wonderful. I know hydration is such a huge part, right? Oftentimes I think, when you're not hydrated for weeks and weeks at a time, some people just, we forget. I know for myself, I'm like, now I have my Stanley and I'm trying my best because again, when you get busy, you use that excuse. I'm so busy. The time is so important, but taking care of that body and making sure that you're putting the right things in it and making sure that they're even educated on the things. I did not know about your IV therapy. I think that's amazing.
Yeah, it's great. One of the big IV therapies that we offer that I'm passionate about is NAD+.
I was going to ask you about that because everybody's talking about, Chelsea, you really need to do this. And then I have these tiny little veins and I'm like, I don't know that they can do it. I mean, I have these tiny little, they're like, no, you really, really, as you get older, I just turned 50 last year. And
nice.
I think for me, it's like, how do I keep up the time and the how busy my schedule is? But tell me about that because I'm so curious. Everybody's talking about it and I think there's huge benefits.
Yeah, nicotinamide adenine dinucleotide. That's an NAD+.
I'm going to say NAD because I cannot just say what she just said. But I love
it. Say that 5 times fast. But it's a very powerful IV drip. I mean, it's a lengthy one. It can take about 5 hours to do, but you're supervised the whole time by our nurse. If you have tiny veins, and you can't do in the big artery there, you can do it in the hands. Okay. So as long as you're like hydrated, she's great at what she does at finding a vein. But I'm passionate about it because it helps, and the research shows that if you're doing it as a regular preventative IV once a year, maybe a little bit more frequent depending on your health history, it slows down neurodegenerative things like setting in Alzheimer's, Parkinson's, and dementia and things like that. So, which a lot of our population, my family included, has dealt with personally. Wow. So I'm renaming that NAD plus IV after my grandmother who passed from Alzheimer's, Linda's IV. So that's one that we're really passionate about, and we promote heavily in our office to anybody that has that in their family history to definitely come in and get that done.
That's amazing. Yeah. I've heard nothing but great things about all of the IVs, and I think oftentimes we forget about that. I'm glad you mentioned it because you do. You're like, oh yeah, she just does this. But no, you have such a long list of individual things that you can do, but also preventative things that you can do like the NAD and all of that. What are some other IV therapies that you've seen great success with that, might make some sense for our listeners?
Yeah, so I mean, we have a great vitamin C drip, especially this time of year when there's a lot of bugs going around. People are getting colds and flus because the temperature changes. So vitamin C is the only researched vitamin that has an immediate effect on your immune system. So you can take the zincs and some of the other vitamins, but if you dose yourself with vitamin C, your immune system goes up immediately. Wow. So that is a very powerful IV that even if you're feeling a little icky, you get that IV within 30 minutes, you're like, oh, I feel much better. So we've seen great results with that one, and we have the NAD there, and then we have just a Myers cocktail blend, which is good of just every single vitamin under the sun that your body might need and feel deficient in. So a lot of patients have reported that once they get that vitamin IV infusion, they feel like their body's vibrating because they have just so much positive energy.
And they need it.
Because magnesium in particular is one of the 80% of our population in the United States is deficient in magnesium. And that controls everything your body does. If you're deficient in magnesium, you may have muscle cramps, you may have digestion issues, you may have sleep issues, you may feel energy like low. And so, if you drink a lot of coffee, that actually depletes your magnesium even more. And so patients are just feeling, like those effects. And magnesium was one of the biggest vitamins that are in the IV infusions.
Wow. I think again, when you don't know, you don't know. Right. And I think it's so important to know and understand so that I want to feel better. I want to stay young, I want to make sure I'm being preventative and making sure that I know that these things are available to me. From a overall perspective, if, you were to think back, I know you have such joy. You can see it. You smile. Yeah. That's what I love is when you can tell that you're really passionate. Yeah. At what age? I know you mentioned your uncle sharing, that with you, but at what age or when did you really go, okay, this is my thing. This is my thing that I'm going to do and I'm going to do it well.
Yeah, I would say like early 20s. I would say like in my early 20s when I was getting into college and, getting my bachelor's and going through the rigmarole of different options and thinking of doing nursing or going to law school or different things. And I'm like, no, I think I'm just going to stick my stake in the sand and I'm going to do chiropractic.
That's awesome. So, I know for me, when I first started my career path, I said, oh, I'm going to be a nurse, and I did. Oh, yeah. Oh, nice. And I loved people so much that the first time I had to deal with, someone being a do not resuscitate, it crushed my soul. And I found myself going, I want to be a nurse, but I don't. My heart is broken. Yeah. And I went back and I got my master's in marketing and then a master's in business. And here I sit loving telling people about, marketing and things like that. So thank you so much for the time that you spent with us.
Thank you.
Dr. Stephanie. It has been so educational and so wonderful. And we're so thankful to have you.
Thank you.
And we just want to thank all of our listeners and all of our sponsors for supporting local. Thank you for everything you do. And just remember that you will see us right here on BaaD Radio on News Radio WFLA Orlando every Sunday. Thank you again for an amazing show and have a great day.